break the stiffness cycle after a wrist fracture. After a wrist fracture, whether you were put in a cast or you had surgery and then you're allowed to start moving, the wrist and the hand, the whole thing can feel really, really stiff, and it feels really frustrating. Like, yes, I broke my wrist, but why does it feel so stiff all the time? Well, let me share with you a little bit more about like how you can recover and how you can recover fully after a wrist fracture and break that cycle of being stiff all the time. My name is Huang. I'm an occupational therapist and certified hand therapist. I have my clinic here in Miami, Florida, and I also teach other therapists all about hand and arm injuries. So stiffness is just a fact of life after a fracture. You fracture your wrist, all the tissues around that fracture, the ligaments, the muscles and tendons, and if you had surgery, all your skin and fascia get really, really tight, because that's just a healing process, and that's totally normal. But here are 5 things to consider if you want to break the cycle of having wrist stiffness after like this wrist injury and surgery. All right, so I'm gonna just tell you 5 and then I'll go into a little bit detail of it. Really important, get started early, do your exercises frequently, get full finger range motion. Your fingers and thumb being really loose is so important into the recovery of your wrist. 4th, of course, what you know, get your wrist motion, but here's the thing, you've got to be able to turn your palm up and down. That's part of having a really good wrist motion, so don't forget to pay attention to that. And the 5th one here, be mindful of the shoulder, and I'm going to explain all of that in a minute. So let me share with you what I normally do with my wrist injuries that come to my clinic and stuff like that. This is protocol, like what it quote unquote should be. Right now, you got to follow whatever your doctor is, because they're the one who knows. Like if your wrist fracture or surgery is more severe, you might not be able to follow, like you might not be able to start as early as possible. But when I was working with this one surgeon here in Miami Beach, we used to, when you had surgery, that means you have a plate and a screw. That means your fracture is considered stable because they put the hardware in. So we would start at day 5 to day 7. We'd take off the post-op dressing, we would put them in a splint, and we would just start gentle motion, right? So we'd make sure the fingers are moving. We would do what's called hook fist, straight fist, just move the thumb tip, touch the thumb to the index finger, to the next finger, to the next finger, and to the next finger. We would just make sure that all the fingers are moving. We started early. And then you would gently move your wrist in what we call a tenodesis pattern. Just means that when your wrist goes down, you open your fingers, because that's the natural attitude of your hand. So try this with me. Just make your hand really limp and just let your wrist fall. When your wrist naturally falls, your fingers naturally open. Now with your other hand, just gently push your wrist back. Your fingers naturally close, right? So that is the natural wrist attitude, natural wrist movement. So we want to use our body's natural way of moving. So we would bring the wrist down, whatever you can tolerate, just gently open your fingers, bring the wrist back a little bit, and gently curl your fingers down. You don't have to be forceful at the beginning. So the first 4 weeks, right? First 5 to 7 days, we're in a post-op dressing, no problem. You move your fingers as much as you can, you move your shoulder as much as you can, you move your elbow as much as you can. And then when they take that off, then you're going to start very gentle range of motion. And during this time, I really would recommend you work with an occupational therapist or a certified hand therapist. Know exactly what you're doing. Ask them questions. This is a video just to kind of guide you a little bit. But really, if you've had surgery, don't be cheap. Go to therapy. It's so important, especially at the first beginning phase of your recovery, right? So we would start range of motion, and then you could progress. You get a little bit more and a little bit more. And within the first 4 weeks, you want to have as much motion as possible. So you want your wrist to be able to come all the way up, come all the way down, and you want to make sure that you can turn your palm all the way up and turn your palm all the way down. Forearm motion, this is called forearm motion, turning your palm up, supination, turning your palm down, pronation. Forearm motion is extremely important to be able to use your wrist in space, right? So you should be able to turn your palm up and bring your wrist back, turn your palm down and bring your wrist down, and bring your wrist up. All right, so these are just normal everyday motions that you need to have. And if you can get your motion, you're going to be better off in the long run. And you can get out of falling into this cycle of stiffness that can happen after a wrist injury and a wrist surgery. So make sure you get started early and you start to, you start your exercises frequently. One of the things that I do for my patients here in Miami, Florida, is I make sure that when they turn their palm up and down, they're not compensating with their shoulder. This is what I see this all the time. I teach all my students, I teach all my patients. You might not be able to see it because you're not looking at yourself in the way that someone else can see you. So you can do this in front of a mirror, right? So I'm looking right here. If I turn my palm up and palm down, this bone right here should stay nice and still. If you go to turn your palm up and you dig your elbow in, or when you go to turn your palm down, your elbow comes out, you are compensating with your shoulder. So this is why the 5 things that, remember that 5th one I was talking about, be mindful of the shoulders, because when your forearm does not rotate, you are going to secondarily mess up your shoulder a little bit. And by mess up, I just mean it can get really stiff and you have to work on that a little bit, okay? Another story, another day, but be mindful of that. But that was number 4 was work on your wrist and forearm, right? Number 1 was start early. Number 2 was do your exercises frequently. Number 3 was really get full range of motion. Make sure you get full range of motion. Sometimes people they look like they have motion because they can touch their palm. But if you don't have what's called a hook fist, meaning this knuckle is straight and these knuckles are down, you have tightness in your hand, and that could cause prolonged wrist stiffness because those muscles start at your wrist level. So when those muscles are really tight, you're going to continue to feel wrist tightness. You're going to feel your wrists being really stiff all the time. So you want to break that cycle of stiffness. You have to make sure your muscles here, your fingers here, all move really well. There's a good chunk of people who after wrist injuries, their fingers are fine. They don't have any problems. And then there's a certain percentage of people after a wrist fracture, their fingers get really, really stiff. And if your fingers get stuck, it becomes painful. It becomes what we in the hand therapy world call a stiff hand. And you don't want that because it's really painful. It takes a really long time and you need a shit ton of therapy. So avoid your fingers from getting stiff if at all possible. And that will always go back to getting started early for me, because the people who get started early and we can kind of catch that early on, we can help it, in majority of the cases. And the 5th one is just being mindful of the shoulder. So in the first 4 weeks, you're just getting a range of motion, right? Between 4 and 6 weeks, you have what's called clinical healing. Your bone is healed, and it's healed really well. So at that time, you can start to push on it a little bit more, and that is also going to help to manage that stiffness. So during that time, you want to start pushing on it a little bit more. Your therapist that you're working with should be able to guide you through it and how to push through it a little bit further. At my clinic, we work in a pain-free way, and there's methodologies and techniques that we use and that I teach. So, but you want to find that kind of therapist who will work with you in a way that makes your therapy tolerable, but also gets you results, period. I'm a results-driven person. I want results for my patients, probably because I want results for myself. So, make sure you work on those things. And then by 3 months, that's 12 weeks. That means by then you can put weight through it. So after around 8 weeks, you can start strengthening, right? And then by 12 weeks, you can put weight on it. What do I mean by weight? You can push down on it. You can push off the floor. You can do push-ups. Those are things you want to be able to do. You can push open a door, no problem. Even if it's really heavy, you can push yourself off of the bed. All those things. You can go back to working out. You enjoy working out. Those things. Be mindful of the shoulder. When I work with a distal radius fracture, anyone with a wrist injury, if you cannot turn your palm up and down, I guarantee you, majority of the time, people get stuck with their shoulder. They'll start to lose a little bit of motion. They'll start to feel like, oh, my shoulder feels so stiff. We're fixing your wrist, but we're not being mindful of your shoulder, right? And we want to be mindful of your shoulder. So if you start having shoulder problems, definitely bring that up to your therapist, because it's something that I do at my clinic. I am mindful of the shoulder. As I'm working with the wrist, I always go back and check the shoulder, and make sure the shoulder is working well. If the shoulder is not working well, the wrist will not work well, and it will continue in stiffness. So go talk to your therapist. They're not listening to you. Find another therapist. If you're in Miami, I can help you. My name is Huang. Those are the ways that you can break that stiffness cycle at your wrist. You have to work all joints. You have to get as much motion as possible and as much as you can based off of your injury, because when you cannot or do not get as much motion as your body is allowing you to get, you will stay in that painful kind of stage, right? And it's totally possible. It always depends. The order of what you do makes a big difference, and the order of the exercises that you do make a big difference in the results that you're getting. So that's what I have on how you can break the cycle of stiffness when you have a wrist surgery. If you have any questions about that, you can leave them below. I'm going to try to make more videos just to inform you and help you make some decisions around what kind of therapy you need. But please, if you've had surgery, find yourself an occupational therapist or a certified hand therapist that specializes in working with these types of injuries. And if you're working with someone and they don't know, I teach therapists as well, so that's on my other channel, but that's neither here nor there for today. Again, if you like this video, leave me a comment, and always, subscribe for more. Thanks.